Hello everyone, welcome to my Medication Academy channel. In the third quarter of 2025, the US FDA approved 16 novel chemical entity drugs. 10 of them are oral small molecule drugs with indications ranging from oncology, hereditary angioedema, non-cystic fibrosis, bronchiectasis, immune thrombocytopenia, acromegaly, and chronic spontaneous urticaria. 4 are injectable agents, including monoclonal antibodies, antisense oligonucleotide, and tetrapeptide molecules, indicated for oncology, prevention of hereditary angioedema, as well as strengthening muscle strength for Bath syndrome. In addition, 2 are topical small molecule agents for treating chronic hand eczema and presbyopia. Now, let's dive into each medication in more detail. Linvoseltamab, brand name LYNOZYFIC. This medication was approved by the US FDA on July 2, 2025. And indicated for the treatment for adult patients with relapsed or refractory multiple myeloma who have received at least 4 prior lines of therapy, including a proteasome inhibitor, immunomodulatory agents, and an anti-CD38 monoclonal antibody. This medication is available as 5 mg per 2.5 milliliter or 200 mg per 10 milliliter for RV injection. Recommended dosage: step-up dosing, 5 mg RV injection on day 1, 25 mg on day 8. The first treatment dose, 200 mg on day 15. Afterwards, 200 mg from week 4 to week 13 every weekly. Week 14 and after, 200 mg RV injection every 2 weeks. After 24 weeks, 200 mg every 4 weeks if needed. This medication carries a US box warning, cytokine release syndrome, and neurologic toxicity. Given the US box warning, cytokine release syndrome, this medication is available only through LYNOZYFIC restricted REMS program, which is a risk evaluation and mitigation strategy. Chemically, this medication is a monoclonal antibody ending with MAB. The molecular weight for this medication is about 146 kilodalton. Given this is a monoclonal antibody, it's a large protein. Therefore, this medication needs to be stored 2 to 8 Celsius, which is 36 to 46 Fahrenheit. Do not freeze. Do not shake. Mechanistically, this immunoglobulin G4 antibody works as a biospecific B-cell maturation antigen, BCMA-directed CD3 T-cell engager. Basically, this monoclonal antibody bound with the CD3 receptor on T-cell. This will activate T-cell. This would bond with the BCMA receptor on the multiple myeloma. This would lead to anti-cancer activity. Pharmacokinetically, volume of distribution 7.05 liter. Metabolism, given this is a monoclonal antibody, larger protein, it will be metabolized into small peptides while catabolism. Drug-drug interactions. Certain CYP substrates, linvoseltamab, causes the release of cytokine, which may suppress CYP enzyme activity. Therefore, this can lead to the increase the risk of adverse reactions related to these substrates. Currently, there's no contraindication listed on the prescribing information. Adverse effects greater than or equal to 20%, musculoskeletal pain, cytokine release syndrome, CRS, cough, upper respiratory tract infection, diarrhea, fatigue, pneumonia, nausea, headache, dyspnea. Sunvozertinib, brand name ZEGFROVY. This medication was approved by the US FDA on July 2, 2025, and indicated for the treatment for adult patients with locally advanced or metastatic non-small cell lung cancer, NSCLC, with epidermal growth factor receptor, EGFR exon 20 insertion mutations. Chemically, this is a small molecule with the pyrimidine, pyrrolidine, and propionamide motif. Molecular weight for this medication, 584.09 gram per mole. Hydrogen bond acceptor 10. Hydrogen bond acceptor refers to the number of oxygen and nitrogens within the drug molecule. Hydrogen bond donor 4. Hydrogen bond donor refers to the number of hydroxy and NH groups within the drug molecule. Log P 2.72. Polar surface area 115 square angstrom. This medication is available as tablets. The strength of the tablets is 150 mg and 200 mg. Recommended dosage 200 mg taken orally once daily with food. Mechanistically, this molecule works as a kinase inhibitor of the epidermal growth factor receptor. Pharmacokinetically, Tmax about 6 hours. Volume of distribution is very large, 2,116 liters. Protein binding, based on in vitro studies, 89 to 94%. Metabolism, CYP3A, that's the major metabolic pathway. Half-life, 50 hours. It's a very long half-life with once daily dosing. Excretion, in the urine 10%, but 5.6% as the parent drug molecule. In the feces, 79%, but 7.3% as a parent drug molecule. Drug-drug interactions, strong and or moderate CYP3A inhibitors, inducers, need to avoid concomitant use because this medication is the CYP3A substrate. Therefore, for patients take strong CYP3A inhibitors, this would lead to increased drug exposure for sunvozertinib. For patients, if they take a P-glycoprotein or BCRP substrates, need to monitor closely. The reason for that, this medication, sunvozertinib, is a P-glycoprotein or BCRP inhibitor. This can lead to increased drug exposure for P-glycoprotein or BCRP substrates. Therefore, need to monitor closely. For patients, if they take hormonal contraceptives, because hormonal contraceptives is a substrate for CYP3A, And this medication, sunvozertinib, is a CYP3A inducer. So therefore, this can lead to decreased exposure for hormonal contraceptives. This can lead to decreased efficacy, for example, leading to unexpected pregnancy. Contraindications. Currently, there are no contraindications listed on the prescribing information. Adverse effects greater than or equal to 20%, diarrhea, rash, decreased appetite, stomatitis. Stomatitis, that's the inflammation of the gum and the mouth. Fatigue, nausea, pyronychia, that's the inflammation of the nails around the toe and finger. Vomiting, constipation, musculoskeletal pain, pruritus, dry skin, urinary tract infection, abdominal pain, and decreased weight. Sebetralstat, brand name, EKTERLY. The meaning behind the brand name, EKTERLY, that's act early. This medication was approved by the US FDA on July 3, 2025, and indicated for the treatment for acute attacks of hereditary angioedema, HAE, in adults and pediatric patients aged 12 years and older. This approval represents the first oral small molecule therapy for the treatment for angioedema. Chemically, this is a small molecule with the 2-oxo-1,2-dihydropyridine motif on the left side of the molecule, pyrazole in the middle, the hexacyclic motif, along with the pyridine motif on the right side. This medication is available as tablets, 300 mg. Recommended dosage, 600 mg, taken orally at the earliest recognition of a HAE attack. A second dose of 600 mg, that's 2 tablets, may be taken 3 hours after the first dose if needed. Maximum recommended dosage, 1200 mg in any 24 hours period. As mentioned, this is a small molecule. Molecule weight 491.5 gram per mole. Hydrogen bond acceptor 9. Hydrogen bond donor 1. Log P 0.77. Polar surface area 99 square angstrom. Mechanistically, this molecule works as a plasma kallikrein inhibitor to block its proteolytic activity. This will decrease the bradykinin levels by controlling excess bradykinin generation. Bradykinin is associated with inflammation and vascular permeability. Therefore, by blocking bradykinin production, this will decrease vascular permeability and edema. Pharmacokinetically, Tmax, that's the time reaching the maximal plasma concentration, is about 1 hour. So you can see it has a quick onset. Volume of distribution, 70.1 liter. Protein binding, based on in vitro studies, 77%. Metabolism, it's a CYP3A4 subject, that's the major metabolic pathway, and also it's a subject for CYP2C8. Half-life, 5.3 to 8.9 hours. Excretion, in the urine, 32%, but 8.7% as a parent drug molecule. In the feces, 63%, but 12.5% as a parent drug molecule. Drug-drug interactions, Strong and moderate CYP3A inhibitors and inducers avoid concomitant use. The reason for that, because this medication is a substitute for CYP3A4. Therefore, patients, if they take a strong CYP3A4 inhibitors, this would lead to increased drug exposure for sebetralstat. In the case of moderate CYP3A4 inhibitors, this need to decrease dose accordingly. For example, take one dose of 300 mg. If needed, a second dose of 300 mg may be taken at least 3 hours after the first dose. Currently, there is no contraindications listed on the prescribing information. Adverse effects, at least 2%, headache. Delgocitinib, brand ANZUPGO. This medication was approved by the US FDA on July 23, 2025. Indicated for the topical treatment of adults with moderate to severe chronic hand eczema. This is a small molecule topical agent with 1,6-diazenyl-spirooctane. That's the motif here, highlighted in blue. And pyrrolopyrimidine motifs, the bicyclic, heterocyclic ring motif. Molecular weight for this medication, 310.4 gram per mole. Hydrogen bond acceptor, 7. Hydrogen bond acceptor refer to the number of oxygen and nitrogens within the drug molecule. Hydrogen bond donor, 1. Hydrogen bond donor refer to the number of hydroxy or NH groups within the drug molecule. Log P, negative 0.1. Polar surface area, 89 square angstrom. This medication is available as a 2% cream, which is 20 mg delgocitinib per 1 gram cream. Recommended dosage, apply twice daily to skin of the affected areas, only on the hands and the wrists. Mechanistically, this medication works as a generous kinase inhibitor, which is a JAK inhibitor. This is a pan-JAK inhibitor targeting JAK1, JAK2, JAK3, and tyrosine kinase 2, modulating signaling pathway, preventing the phosphorylation and activation of STATs. STATs refer to signal transducer and activator of transcription. The dysregulation of JAK and STATs pathway has been implicated with various cancers and autoimmune disease, although the exact mechanism for action toward CHE is unclear. Pharmacokinetically, protein binding 22 to 29%. Metabolism, delgocitinib didn't go through extensive metabolism. The major metabolic pathway is based on CYP3A4 or 5. Half-life is about 21 hours. This medication is primarily go through the renal elimination. In the urine, 75% as a parent drug molecule. This is based on the oral dosing studies. Drug-drug interactions. Given this is a topical agent, so therefore drug-drug interactions are expected to be minimal. In addition, per in vitro studies, delgocitinib doesn't inhibit or induce CYP450 enzymes or inhibit transporter systems, for example, P-glycoprotein, PGP, breast cancer resistant protein, BCRP, organic A9 transporting protein, OATP, organic A9 transporter, OAT, organic cation transporter, OCT, or multi-drug and toxin extruding protein, MATE, at clinically relevant concentrations. Currently, there is no contraindications listed on the prescribing information. Adverse effects less than or equal to 1%. Application site pain, parasthenia, pruritus, erythema, so that's the abnormal redness of the tissues, and the bacterial skin infections, including finger cellulitis, paronychia. Paronychia, that's the inflammation and the infection of tissues around the nails. Other skin infections, leukopenia, neutropenia, so that's the abnormal low counts of white blood cells and neutrophils. Sepiapterin, brand name SEPHIENCE. This medication was approved by the US FDA on July 28, 2025, and indicated for the treatment for hyperphenylalaninemia, HPA, in adults and pediatric patients aged 1 month and older with sepiapterin-responsive phenylketonuria, PKU. This medication is a small molecule with 7,8-dihydropteridine, 3 known motif. So that's the bicyclic heterocyclic motif, dihydropteridine. With regard to dosage forms, this medication is available as oral powder, 250 mg and 1,000 mg. Recommended dosage, starting dosage for age less than 6 months old, 7.5 mg per kilogram. For age more than 6 months to less than 1 year, 15 mg per kilogram. For age over 1 year to less than 2 years, 30 mg per kilogram. For age 2 years and older, 60 mg per kilogram, taken orally once daily with food. Again, this is a small molecule agent, molecular weight 237.2 gram per mole. Hydrogen bond acceptor 8. Hydrogen bond acceptor refers to the number of oxygen and nitrogens within the drug molecule. Hydrogen bond donor 5. Hydrogen bond donor refers to the number of hydroxy and NH groups within the drug molecule. Log P minus 3.93. Polar surface area 129 square angstrom. Mechanistically, this agent works as a phenylalanine hydroxylase PAH activator. Basically, for this indication, treatment for hyperphenylalaninemia, HPA. So that's the elevated level of phenylalanine amino acid in the blood. So therefore, this medication works by this pH activator, and so therefore this would lower the level for phenylalanine, the amino acid in the blood. So therefore, they can be converted to tyrosine by this phenylalanine hydroxylase. In addition, so this medication needed to be given in conjunction with the phenylalanine restricted diet. Pharmacokinetically, Tmax, that's the time to reach maximum plasma concentration, it's 1 to 3 hours. 4 hours for the active metabolites, BH4, that's the tetrahydrobiopterin. Protein binding, about 15.4% for the parent drug molecule, sepiapterin. For BH4, the active metabolites, about 24 to 41%. Half-life, about 5 hours for the active metabolites, BH4. Volume of distribution, So you can see that's for the BH4 active metabolites, it's very large, 11,433 liter metabolism. And this agent's sepiapterin, so that's the precursor. So sepiapterin will be converted to BH4 molecules by two sequential reduction steps. So the first reduction by SR, so that's the sepiapterin reductase or the carbonyl reductase, basically converting this carbonyl to the secondary alcohol will be reduced by this SR enzyme. So this would be converted to BH2. BH2, that's the dihydrobiopterin. And this would be further reduced by the DHFR, so that's the dihydrofolate reductase. This would be converted to the active metabolites, that's the BH4, that's the tetrahydrobiopterin. So that's the cofactor for this phenylalanine to, for example, phenylalanine to tyrosine. That's the cofactor for this hydroxylase, this step. From metabolic aspect, and this sepiapterin will be converted to the BH4, the active metabolites, by two sequential steps. One is sepiapterin reductase, that's also carbonyl reductase, convert to BH2 metabolites. BH2 will be reduced again to BH4, so that's the tetrahydrobiopterin active metabolites. Excretion in the urine 6.7%, in the feces 26%. Drug interactions, as mentioned, this sepiapterin needed to be converted to the active metabolites by two sequential reductase enzymes. So therefore you can see this DHFR inhibitors and HR inhibitors. That's first the DHFR, that's the dihydrofolate reductase inhibitors. For example, trimethoprim and methotrexate, DHFR inhibitors. So the SR inhibitors, that's the sepiapterin reductase inhibitors. So for example, the sulfasalazine, this molecule, and also the sulfamethoxazole. Avoid concomitant use. If unavoidable, so make sure monitor the phenylalanine blood levels accordingly. Interaction with the levodopa, and basically this agents, how this agent works, and this agents will be convert the phenylalanine to tyrosine, right, by this phenylalanine hydroxylase along with the cofactor BH4. So the tyrosine, that's the precursor for levodopa. So therefore, with the increased level of tyrosine, so this can potentially increase the level of levodopa. This can increase the risk for seizure, for example. So therefore, monitor patients for a change in neurological status. In addition, the drugs affecting nitric oxide mediated visual relaxation, and for example, the phosphodiesterase 5 inhibitors, that's the PD5 inhibitors for the treatment for erectile dysfunction, and there is a potential for visual relaxation due to the additive effects for hypotension. The blood pressure can get too low, so therefore monitor blood pressure accordingly. Currently, there are no contraindications listed on the prescribing information. Adverse effects greater than or equal to 2%, diarrhea, headache, abdominal pain, hypophenylalemia. Because if the level drops too low for phenylalanine in the blood, so this can lead to hypophenylalemia. Feces discoloration or oropharyngeal pain. Aceclidine, brand name VIZZ. This medication was approved by the US FDA on July 31st, 2025. and indicated for the treatment for presbyopia in adults. Chemically, this is a topical small molecule with the quinoclidine, that's the highlight in blue, with the tertiary imine motif, and the ester motif, which is highlighted in red. Molecule weight for this medication is 169.2. That's for the free drug form. Because this is a tertiary imine, this medication is a basic agent with a tertiary imine functionality. So this medication is available as a salt form, hydrochloride salt form. But the molecule weights here, that's for the free base form, 169.2 gram per mole. Hydrogen bond acceptor 3, hydrogen bond donor 0, log P 0.43, polar surface area 30 square angstrom. Mechanistically, this medication works as a cholinergic muscarinic agonist, stimulating muscarinic receptors on smooth muscles, interacting with the iris with minimal ciliary muscle stimulation. So basically, this is a pupil selective miotic agent. So you can see it has a minimal impact on ciliary muscle stimulation. So this would cause the iris sphincter muscle contraction, resulting in pinhole effects that extend the depth of focus to improve vision. So in addition, this is a small molecule topical agents, the eye drop, and so it's the dosage form is available as 1.44% for topical or formic solution. Pharmacokinetically, given its topical ocular dosing, the drug exposure in plasma is minimal. The onset for this medication is about 30 minutes, lasting for about 10 hours. Metabolism, ester hydrolysis, because there is an ester motif in the middle, this ester will be hydrolyzed to convert to the metabolites, the secondary alcohol metabolites. Drug-drug interactions. So given this is a topical eye drop, therefore no clinically significant drug interactions are expected. Currently, there are no contraindications listed on the prescribing information of VIZZ. Adverse effects, instillation site irritation, about 20% for patient population from the clinical trials. Dim vision, about 16%. Headache, about 13% of patient population. Another benefits for this medication, because this is a topical eye drop, but it doesn't contain any preservatives, so therefore it's a preservative-free eye drop. So make it more patient compliance. Dordaviprone, brand name MODEYSO. This medication was approved by the US FDA on August 6, 2025, and indicated for the treatment for adults and pediatric patients aged 1 year and older with diffuse midline glioma harboring a H3 K27M mutation with progressive disease. Basically, for this indication, diffuse midline glioma is a very rare and aggressive brain tumor. With this particular mutation for H3 histone, you can see the mutation is at a 27 position from the lysine to methionine. This medication is available as a capsule. The strength of the medication is 125 milligram. This is a small molecule with the hexahydroimidazole pyrimidine motif along with the benzoyl motif on both sides. So in the middle, there's a tricyclic core motif in the middle. Given this is a small molecule, the molecule weight is 386.5 gram per mole. Hydrogen bond acceptor 5. Hydrogen bond acceptor refers to the number of oxygen and nitrogens within the drug molecule. Hydrogen bond donor 0. Hydrogen bond donor refers to the number of hydroxy and NH groups within the drug molecule. Log P 3.14. Log P, that's the lipophilicity profile parameter of the drug molecule. The higher log P, which means more lipophilic. In this case, it's over 3, so therefore this is a lipophilic drug molecule. Also think about this is for brain tumor, so therefore this medication is able to penetrate the blood-brain barrier, BBB. Polar surface area, 39 square angstrom. Recommended dosage for adults, 625 milligram, that's 5 capsules, taken orally once weekly on an empty stomach, at least 1 hour before or 3 hours after food intake. For pediatric dosing, it's a weight-based dosing, 125 to 625 milligram, taken orally once weekly. See prescribing information for details. Mechanistically, this medication works as a protease activator of the mitochondrial case-enolatic protease P, that's the CLPP, along with blocking the dopamine D2 receptor. So basically this medication, particular indication is a diffuse midline glioma, so that's the brain tumor with this particular mutation at the 27 position, the lysine to methionine. So therefore, by this mutation, so this would will be losing the trimethylation from the lysine. So therefore, this medication works as a protease activator of the mitochondrial case-enolatic protease P, CLPP, along with blocking the dopamine D2 receptor. Pharmacokinetically, Tmax, that's the time to reach the maximal plasma concentration, 1.4 hour. Volume of distribution, 450 liter. Protein binding, 95 to 97%. Metabolism. This medication is primarily metabolized by CYP3A enzyme, along with some other CYP enzymes 2B6, 2C8, 2C9, 2D6, and 3A5. Half-life is about 11 hours. Excretion in the urine 70% and in the feces 20%, but mostly as metabolites in the urine and feces. Drug-drug interactions. Giving this medication is metabolized by CYP3A4 enzyme. So therefore you can see for strong and moderate CYP3A inhibitors, avoid concomitant use. So the reason for that, this would increase the drug exposure for dordaviprone. If unavoidable, so make sure lower the dose accordingly. For strong and moderate CYP3 inducers, this would lower the drug exposure, so therefore avoid concomitant use. For patients, if they also take some other drugs known to prolong the QTc interval, and avoid concomitant use. If unavoidable, so make sure space out the medication accordingly. Adverse effects greater than or equal to 20%, fatigue, headache, vomiting, nausea, musculoskeletal pain. Zongertinib, brand name HERNEXEOS. This medication was approved by the US FDA on August 8, 2025, and indicated for the treatment of adults with unresectable or metastatic non-squamous non-small cell lung cancer whose tumors have HER2, so that's the gene you can see mutation for ERBB2 tyrosine kinase domain activating mutations. So basically this is more specific for HER2 targeting medication. You can see under the brand name, so that's HERNEXEOS. That also kind of indicates this medication works specifically for this HER2. This medication is available as a tablet, 60 milligram. It's a small molecule with the piperidine and pyrimidine, the bicyclic ring motif in the middle, along with the benzimidazole motif on the right side here. Recommended dosage, weight-based dosing for patients. The weight is less than 90 kilogram. The dosing is 120 milligram, taken orally once daily with or without food. For patients, weights if greater than or equal to 90 kilogram, the dosing is 180 milligram, so which is 3 tablets, taken orally once daily dosing. As mentioned, given this small molecule, you can see the molecule weight is 535.6 gram per mole, 100 bound acceptor 11, 100 bound donor 2, log P 2.6, polar surface area 123 square angstrom. Mechanistically, this medication works as a kinase inhibitor, also giving the suffix, you can see the drug name ending with tinib. So that's the kinase inhibitor of HER2. So that's the human epidermal growth factor receptor 2. By blocking this specific HER2 kinase, this would blocking the downstream phosphorylation of ERK pathway. That's the extracellular signal related kinase. So therefore, this would causing the programmed cell death. Will have this anti-cancer effect. Pharmacokinetically, Tmax, that's the time to reach the maximal plasma concentration. It's about 2 hours. Half-life is about 12 hours. Oral bioavailability, 76%. Volume of distribution is 118 liter. Protein binding, it's over 99%. Metabolism. This medication is metabolized by sepa3A4, sepa3A5, along with the phase 2 conjugation metabolism with the UGT1A4. So that's conjugates with the glucuronic acid and also conjugates with the glutathione. And go through the phase 2 conjugation metabolism. Excretion in the urine 1.3%. But 0.2% as a parent drug molecule. In the feces, 93%, but 31% as a parent drug molecule. Drug-drug interactions. Given this medication is metabolized by sepa3A4, so therefore you can see for strong sepa3 inducers, avoid concomitant use because the sepa3A inducers, this would decrease the drug exposure for zongertinib. So therefore, this can have a decrease the efficacy. If unavoidable, so this can increase the dosing accordingly. BCRP substrates, the BCRP, that's the breast cancer resistant protein, in particular for BCRP substrates with a narrow therapeutic index. So make sure avoid concomitant use or monitor the patients closely for adverse effects. So the reason for that, this medication zongertinib is a BCRP inhibitor. So therefore, this can increase the drug exposure for BCRP subjects for patients if they take other medication if they are BCRP subjects. So this can lead to increased drug exposure and can have a potential adverse effect as well. Adverse effects greater than or equal to 20% diarrhea, hepatotoxicity, that's the liver toxicity, rash, fatigue, and nausea. Brensocatib, brand name BRINSUPRI. This medication was approved by the US FDA on August 12, 2025, and indicated for the treatment for adults and pediatric patients aged 12 years and older with non-cystic fibrosis bronchiectasis, NCFB. This is a small molecule with 1,4-oxazepine, so that's the 7-membered ring. So that's 1,4-oxazepine, cyano group, as well as the 2-oxadihydrobenzoxazole. So that's the heterocyclic motif on the right side. This medication is available as tablets. The strength is 10 mg or 25 mg. Recommended dosage 10 mg or 25 mg, taken orally once daily with or without food. As mentioned, this is a small molecule. Molecule weight is 420.5 gram per mole. Hydrogen bond acceptor 8, hydrogen bond donor 2, log P 0.92, polar surface area 104 square angstrom. Mechanistically, this medication works as a competitive and reversible DPP1, that's the dipeptidase 1 inhibitor. So by blocking DPP1 enzyme, this would blocking the pro-inflammatory neutrophil serine protease NSP during the neutrophil maturation in the bone marrow. So therefore, this medication kind of targets the inflammatory factor. So in this process, so that's the bronchiectasis, that's the chronic lung disease, inflammation. Pharmacokinetically, Tmax 1 to 1.4 hours, absorption over 80%, volume of distribution at steady state 126 to 138 liter, protein binding 87.2%, metabolism. This medication is primarily metabolized by CYP3A enzyme, and then the CYP2C8 and the 2D6 play a minor role in the metabolism. Half-life is 25 to 39 hours, so therefore it's a pretty long half-life. It's once daily dosing. Excretion in the urine 54.2%, but 22.8% as a parent drug molecule. In the feces 28.3%, but 2.4% as a parent drug molecule. Drug-drug interactions. Strong and moderate CYP3A4 inhibitors, inducers, or the P-glycoprotein inhibitors. This would impact the BRINSUPRI exposure. So for example, this medication is metabolized by CYP3A. So therefore, for patients, if they take strong and moderate CYP3A inhibitors, so for example, the antifungal agents, the itraconazole, or the macrolide antibiotics, and clarithromycin. So this would increase the drug exposure for BRINSUPRI. Similarly, for patients, if they take a strong and moderate CYP3A inducers, so for example, the anti-seizure medication, the phenytoin, or rifampin, or shundoxorid, So this would decrease the drug exposure for BRINSUPRI. So in other cases, this would impact the drug exposure, and so therefore needed to make some dosing adjustment accordingly, or need to monitor the patients accordingly. For the adverse effects, greater than or equal to 2%, upper respiratory tract infection, headache, rash, dry skin, hyperkeratosis, palpitation. Donidalorsen, brand name, DAWNZERA. This medication was approved by the US FDA on August 21st, 2025, and indicated for prophylaxis to prevent attacks of hereditary angioedema, HAE, in adult and pediatric patients aged 12 years and older. Hereditary angioedema is a rare genetic disorder. Chemically, this is an antisense oligonucleotide, ASO, in acetylgalactosamine GalNAc conjugates, consisting of 20 linked nucleotide subunits with 2' 2-methoxyethyl groups and the phosphorothioate linkage. So you can see this side on the right side, that's the nucleotide linkage with 20 linked subunits. On the left side, so that's the 3-sugar moiety, the N-acetylgalactosamine. So this sugar moiety will be helping the drug delivery to the hepatocytes, will be bonding with the receptors on the hepatocytes. Molecular weight for this medication, 9,112.27 Dalton. So you can see this is a large molecule with 20 nucleotide subunits. So with all this sugar moiety along with phosphorothioate linkage in between. This medication is available as a subcutaneous injection. The dosage forms is 80 mg per 0.8 milliliter in a single dose auto-injector. Recommended dosage 80 mg subcutaneous injection every 4 weeks or 80 mg every 8 weeks. Mechanistically, this medication is a RNA-targeted therapy, works as a prekallikrein PKK-directed antisense oligonucleotide by binding to PKK mRNA, causing mRNA degradation. So therefore, this would decrease the production for PKK protein, as well as plasma kallikrein and bradykinin. Bradykinin is an inflammatory mediator for causing acute attacks of hereditary angioedema. Therefore, by lowering the production for bradykinin, this would prevent acute attacks of hereditary angioedema. Pharmacokinetically, Tmax, that's the time to reach maximal plasma concentration, about 2 hours. Central volume of distribution, 69.8 liter. Peripheral volume of distribution, 1,840 liter. Protein binding, over 98%. Metabolism, this medication will be metabolized into smaller nucleotides because they have this 20 oligonucleotide subunits. So this would be broken down into smaller nucleotides via the enzyme, the nucleases. Half-life, it's about 1 month. Given its very long half-life, so you can see this dosing frequency for this drug is every 4 weeks or every 8 weeks. Excretion in the urine less than 1% as a parent drug molecule within 24 hours. Drug-drug interactions. On the basis of in vitro studies, no clinically significant drug-drug interactions are expected. Contraindications. History of serious hypersensitivity reactions. For example, anaphylaxis to donidalorsen or any excipients within DAWNZERA drug product. Adverse effect greater than or equal to 5%. Injection site reactions. Upper respiratory tract infection. Urinary tract infection. Abdominal discomfort. Rizabrutinib, brand name VIZZ. This medication was approved by the US FDA on August 29, 2025, and indicated for the treatment for adult patients with persistent or chronic immune thrombocytopenia, ITP. This is a small molecule with the pyrazolo-pyrimidine motif. That's the bicyclic ring motif in the middle. Pyrimidine along with the piperazine motif. This medication is available as a tablet. The strength is 400 mg. Recommended dosage 400 mg, taken orally twice daily dosing. Swallow whole with water, with or without food. Do not cut, crush, or chew tablets. As mentioned, this is a small molecule. Molecular weight is 665.8 gram per mole. Hydrogen bond acceptor 12. Hydrogen bond acceptor refer to the number of oxygen or nitrogens within the drug molecule. Hydrogen bond donor 2. Hydrogen bond donor refer to the number of hydroxy or NH groups within the drug molecule. Log P 3.11. Log P, that's the parameter for lipophilicity. The higher log P, which means the molecule is more lipophilic. Polar surface area 139 square angstrom. Mechanistically, this medication works as a covalent reversible kinase inhibitor against the bronchial tyrosine kinase, that's BTK. As you can see based on the drug name, so this drug ending with proteasome, so suggests this is a member of inhibitor against the bronchial tyrosine kinase, mediating its therapeutic effects in ITP through immune modulation. For example, inhibition of B cell activation and interruption of antibody-coated cell phagocytosis. So in addition, this is a small molecule, works as a covalent reversible kinase inhibitor because within the drug molecule, so this motif functions as a macroreceptor. So this can react with, for example, nucleophile for the thiol. So this can attack this carbon. So therefore, this is the motif functioning for this covalent reversible kinase inhibitor. Pharmacokinetically, Tmax, that's the time to reach the maximal plasma concentration, about 2 hours. Oral bioavailability, 4.7%. Given this molecule has a relatively large molecular weight, you can see it's 665.8 gram per mole. In addition, the hydrogen bond acceptor is 12. It's more than 10. So therefore, you can see this molecule doesn't has very favorable physiochemical properties for oral absorption. So therefore, you can see the oral bioavailability in this case is pretty low, 4.7%. Volume of distribution, 149 liter. This was based on the intravenous studies. Protein binding, 97.5%. Half-life, 1.6 to 4.5 hours. So therefore, you can see the half-life for this molecule is relatively short. However, so this drug molecule, you can see, works as a covalent reversible kinase inhibitor, high specificity for the targets for this Bruton tyrosine kinase. So therefore, this medication is taken twice daily with the BID dosing. Metabolism. This medication is primarily metabolized by SEP3A enzyme. Excretion in the urine 5%, but 0.03% as a parent drug molecule. In the bile, about 6%. In the feces, 86%, but 9% as a parent drug molecule. Drug-drug interactions. Given this medication is metabolized by SEP3A enzyme, so therefore you can see for strong or moderate SEP3A inhibitors, avoid concomitant use because the inhibitors will increase the drug exposure for rezabrutinib. So this can lead to the risk of increasing the side effects. In a similar context, for patients, if they take strong or moderate SEP3A inducers, this can lead to decreased drug exposure for rezabrutinib. This can have the decreased efficacy. In addition, for patients, if they take PPI, that's the proton pump inhibitors, avoid concomitant use, because if you look at the drug molecule, this is a basic drug molecule with the piperazine motif with 2 tertiary amine. So this drug molecule requires acidic environments for absorption. So therefore, for patients, you can see take proton pump inhibitors, avoid concomitant use because this can lead to the decreased absorption for rezabrutinib. In addition, for patients, if they take other gastric acid reducing agents, for example, antacid or histamine 2 receptor antagonist blockers, take VIZZ at least 2 hours before gastric acid reducing agents because this can lead to the decreased absorption for rezabrutinib. Adverse effects greater than or equal to 10%. So you can see the adverse effects relatively mild. It's primarily for the GI related, so for example, diarrhea, nausea, abdominal pain, in addition, headache, COVID-19. Pembrolizumab, baron hyaluronidase alpha, brand name KEYTRUDA QLEX. This medication was approved by the US FDA on September 19, 2025, and indicated for the treatment for adults and pediatric patients aged 12 years and older and weighing greater than 40 kg, which is 88 pounds. Solid tumor indications. Approved for intravenous formulation of pembrolizumab. So this new medication is a new formulation for subcutaneous injection. Previously, KEYTRUDA is given intravenous infusion. So therefore, this is a upgrade for the formulation from RV intravenous to subcutaneous injection. So KEYTRUDA was the #1 best-selling drug in 2024 with the worldwide sales $29.5 billion. And this new formulation is given subcutaneously. This medication is available as 165 mg for pembrolizumab and 2,000 units for bearing hyaluronidase enzyme per milliliter for sub-Q use. The strength of this medication is available as 2.4 or 4.8 milliliter vial. So in addition, this brand name of this product, KEYTRUDA QLEX, and so because this medication is given sub-Q, and so QLEX, and that's why we can remember this medication, KEYTRUDA QLEX. In addition, if you look at the pembrolizumab, so it's ending with zumab, and this is a humanized monoclonal antibody. Recommended dosage is every 3 weeks dosing or every 6 weeks dosing. So for every 3 weeks dosing, it's 395 mg for pembrolizumab and 4,800 units for bearing hyaluronidase enzyme. Inject 2.4 milliliter subcutaneously in the abdomen or thigh over 1 minute. Alternatively, this medication can be given every 6 weeks, 790 mg for pembrolizumab and 9,600 units for bearing hyaluronidase enzyme. Inject 4.8 milliliter subcutaneously over 2 minutes. So basically, this sub-Q version of KEYTRUDA QLEX, is given either every 3 weeks sub-Q injection over 1 minute, or every 6 weeks sub-Q injection over 2 minutes. So if you think about the RV KEYTRUDA before, so typically it's giving over 30 minutes RV infusion every 3 weeks or every 6 weeks. So you can see changing from the RV dosing to sub-Q injection in this case. So the change from the RV infusion time from 30 minutes to 1 or 2 minutes. As mentioned, this is a combination medication product with the pembrolizumab. Molecular weight for pembrolizumab is about 149 kilodalton. And then in addition, there is an enzyme within the drug medication products, which is called the bearing hyaluronidase, the enzyme. Mechanistically works as a combo of pembrolizumab, and so pembrolizumab is a PD-1 blocking antibody. It's a programmed death receptor PD-1 blocking antibody, PD-1 inhibitor. So therefore, this would blocking the interaction with the PD-1 ligands, PD-L1, PD-L2. So therefore, this would restore the immune and the T cell response. The purpose to add the enzyme bearing hyaluronidase alpha. So this enzyme is endoglycosidase, and so this would break down the polysaccharides for urine, which is called hyaluronate. So it's a polysaccharide, and this would enhance the permeability of the subcutaneous tissue. Pharmacokinetically, Tmax, which is the time to reach the maximal drug concentration, is about 4 days. Bioavailability is about 60%. So therefore, you can see the conventional intravenous dosing for pembrolizumab is about 200 milligram or 400 milligram every 3 or every 6 weeks. But in this case, given the bioavailability is about 60%, so therefore you can see the sub-Q dosing is almost double the RA dosing in this case. So you can see either 395 milligram for pembrolizumab or it's 790 milligram for pembrolizumab. Volume of distribution is about 6 liters. Half-life about 22 days. So therefore you can see the dosing regimen is every 3 weeks or every 6 weeks. Contraindications: patients with known hypersensitivity to barium hyaluronidase alpha, hyaluronidase, or to any excipients within the drug product. Adverse effects greater than or equal to 20%, nausea, fatigue, musculoskeletal pain. Elamipretide, the brand name for ZENITY. This medication was approved by the US FDA on September 19, 2025, and indicated for improving muscle strength in adults and pediatric patients with BAS syndrome weighing at least 30 kilograms, which is 66 pounds. So as you can see, based on the brand name for ZENITY, so basically the indication for this medication is to improve muscle strength and muscle force. So that's one way you can remember this brand name, force for ZENITY. So basically, so if you look at the drug structure, this is a synthetic tetrapeptide containing this D-arginine and also dimethyltyrosine and also the lysine. So this medication is available as 280 milligram per 3.5 milliliter solution for injection in a single patient use vial for subcutaneous injection use. The recommended dosage for this medication, patients at least 30 kilogram, so which is 66 pounds, 40 milligram subcutaneous injection once daily dosing. So as mentioned, this is a synthetic tetrapeptide. So you can see molecular weight for this medication is 639.8 gram per mole, hydrogen bond acceptor 14. So hydrogen bond acceptor refer to the number of oxygen and nitrogens within the drug molecule. Hydrogen bond donor 14. Hydrogen bond donor refer to the number of hydroxy and amino groups within the drug molecule. Log P 0.54. So basically the higher log P, the more lipophilic drug molecule is. So you can see the log P in this case is about 0.54. It's a relatively hydrophilic molecule. Polar surface area is 267 square angstrom. So in addition, this is a tetrapeptide, contains this D-arginine and dimethyltyrosine and also the lysine and phenylalanine molecule. So there are several, you can see, basic functionality with the primary amine and also with the arginine functionality. So therefore, this medication is available as the salt form with the 3 molecules of hydrochloride salt form. Mechanistically, this medication works as a mitochondrial cardiolipid binder, localizing the inner mitochondrial membrane. So because of the basic functionality, you can see immune functionality along with guanidine motif. So it will be protonated, will be positively charged. So therefore, the medication can interact with the phospholipid on this mitochondrial membrane. So therefore, this would increase the mitochondrial structure, morphology, and function. Pharmacokinetically, Tmax, that's the time to reach the maximal drug concentration, is about 30 minutes to 1 hour. Bioavailability is about 92%. Protein binding is relatively low, 39%. Volume of distribution is 0.5 liter per kilogram. Metabolism, given this is a tetrapeptide, it will be metabolized to inactive M1 tripeptide and M2 dipeptide via sequential C-terminal degradation. Excretion in the urine, so you can see about 100% will be excreted in the urine after 48 hours post-dose. Drug-drug interactions. On the basis of current in vitro and in vivo studies, no clinically significant drug-drug interactions are expected. Contraindications: serious hypersensitivity to any of the ingredients within the Forzinity drug product. Adverse effects: injection site reactions. Immunodetrient, brand name, Inluriel. This medication was approved by the US FDA on September 25, 2025, and indicated for the treatment for adults with ER-positive, HER2-negative, ESR1 mutated advanced or metastatic breast cancer. ER-positive refer to estrogen receptor positive. HER2-negative refers to human epidermal growth factor receptor 2 negative. ESR1 mutation refer to the mutation related to estrogen receptor. This is an oral small molecule with aceclidine and tetracyclic benzopyrenyl quinoline motifs. The molecular weight for this medication is 524.5 gram per mole. Hydrogen bond acceptor 5. Hydrogen bond acceptor refer to the number of oxygen and nitrogens within the drug molecule. Hydrogen bond donor 1. Hydrogen bond donor refer to the number of hydroxy and NH groups within the drug molecule. Log P, that's the parameter for lipophilicity. The higher log P, the more lipophilic. The log P is 5.99, which is a pre-lipophilic molecule. Polar surface area 55 square angstrom. In addition, given the drug molecule contains the aceclidine motif, has the tertiary imine motif, so therefore this medication is available at the salt form with toluene sulfuric acid, tosylate. Mechanistically, this medication works as an estrogen receptor antagonist. So you can see based on the drug name ending with estrance. So you can see estrogen and antagonist. So therefore, this medication works as an estrogen receptor antagonist while inducing degradation of estrogen receptor alpha and subsequent inhibition of ER-dependent gene transcription and cellular proliferation in ER-positive breast cancer cells. Currently, some other estrogen receptor medications include elencastrant, which has been approved in 2023 for the same indication. The older estrogen receptor antagonist, fulvestrant, which has been approved by the US FDA in 2002 for the treatment for breast cancer. Pharmacokinetically, Tmax, that's the time to reach the maximal drug concentration, about 4 hours. Oral bioavailability, you can see is relatively low, about 10%. Given the molecular weight is over 500 along very lipophilic drug molecule, log P is about 6. So therefore you can see that oral bioavailability is pretty low, 10%. Volume of distribution is very large. Given this drug molecule is a very lipophilic drug molecule, which has a very large volume of distribution, 8,120 liters. Protein binding is greater than 99%. Half-life, 30 hours. So you can see this medication has a long half-life. So therefore, you can see the dosing, that's the once daily dosing. Metabolism, this medication will be metabolized by the CYP3A enzyme along with the phase 2 conjugation pathway with the sulfates and the glucuric acid. Excretion in the urine about 0.3%, in the feces 97%, but 62% as a parent drug molecule. Drug-drug interactions. Given this medication is metabolized by CYP3A enzyme, so you can see for patients if they take strong CYP3A inhibitors, for example, itraconazole, the antifungal agents, clarithromycin, antibiotics, and this would lead to increased drug exposure for immunonutrients. In a similar context, for patients if they take Inurio with strong CYP3A inducers, so for example, rifampin or with carbamazepine, so the anticonvulsant agents, this would decrease the drug exposure for immunonutrients. Therefore, in both cases, need to avoid concomitant use. If unavoidable, so make sure to adjust Inurio dose accordingly. Specifically for patients if they take a strong CYP3 inhibitors, need to lower the dose for Inurio. For patients if they take a strong CYP3 inducers, given the lowered drug exposure for immunonutrients, so you have to increase the Inurio, the dosing. Currently, there are no contraindications listed on the prescribing information. Adverse effects greater than or equal to 10%, musculoskeletal pain, fatigue, diarrhea, constipation, abdominal pain. Proteasome, brand name Palsonify. This medication was approved by the US FDA on September 25, 2025, and indicated for the treatment for adults with acromegaly. This is a small molecule oral agent with piperidine, so the basic motif along with the primary immune, as well as quinoline, which is the bicyclic heterocyclic motif highlighted in red. The molecular weight for this medication is 456.5 gram per mole, 100 bound acceptor 5, 100 bound donor 3, log P 4.5. So you can see this is a pretty lipophilic drug molecule. Polar surface area 86 square angstrom. Given this is a basic drug molecule, so you can see this medication is available as a salt form with hydrochloride. Mechanistically, this medication works as a somatostatin receptor agonist. So therefore, this would suppress growth hormone GH and the insulin-like growth factor 1, RGF1 secretion. In addition, this medication is available as 20 milligram or 30 milligram tablets. So therefore, you can see the recommended dosage. The initial starting dose is a 40 milligram taken orally once daily with water on an empty stomach at least 6 hours after a meal or at least 1 hour before the next meal. If needed, lower the dose accordingly to 20 milligram. After 2 to 4 weeks, titrate to 60 milligram once daily based on this insulin-like growth factor 1, RGF1 levels. Pharmacokinetically, Tmax, that's the time to reach the maximal drug concentration, 1 to 4 hours. Volume of distribution is 220 liters. Protein binding, 99%. Half-life, 28 hours, so pretty long half-life. So you can see, so that's why this medication is taking once daily dosing. Metabolism. Given the presence of phenyl hydroxy along with the primary immune motif, so this medication you can see can go through the phase 2 conjugation metabolism with glucuronic acid, specifically UGT1A1 or 1A9 enzyme. In addition, this medication can be metabolized by CYP3A4, CYP3A5, and 2D6 enzymes. Excretion in the urine about 3.9%, in the feces 90%, but mostly as the parent drug molecule. Drug-drug interactions. Given this medication is metabolized by CYP3A enzymes, you can see for patients if they take Palsonify with other strong or moderate CYP3A inducers, because the inducers will lower the drug exposure for Palsonify, so therefore may require some dosage adjustment. So specifically, if patients take strong CYP3A inducers, because this would lower the drug exposure for proteasome, so therefore you need to increase the dose accordingly. For patients, if they take a Palsonify together with the PPI, that's the proton pump inhibitors, may require some dosage adjustment accordingly. The reason for that, if you look at the chemical structure for proteasome, this is a basic drug molecule and has a pH-dependent solubility profile, which means in more acidic environments, this medication will dissolve faster and lead to higher absorption. So therefore, for patients, if they take this medication together with the PPI, because PPI will increase the pH value, so therefore this would lead to decrease the solubility and decrease absorption for proteasome. So therefore, this may increase the dose accordingly. So in addition, if for patients take a Palsonify together with cyclosporine, and so this can lead to decreased drug exposure for cyclosporine, which is immune suppressant. This may require some dosage adjustment accordingly for cyclosporine. Currently, there are no contraindications listed on the prescribing information. Adverse effects greater than or equal to 5%, diarrhea, abdominal pain, nausea, decreased appetite, sinus bradycardia, hyperglycemia, palpitations, gastroenteritis. Remibrutinib, brand Remsado. This medication was approved by the US FDA on September 30th, 2025, and indicated for the treatment of chronic spontaneous urticaria, CSU, in adult patients following H1 antihistamine therapy. This is a oral small molecule agent with pyrimidine in methylpropylenamide. So that's the Michael acceptor, giving the double bonds electron withdrawing effect from carbonyl, as well as cyclopropyl motifs, which is highlighted in pink here. This medication is available as a 25 milligram tablet. The recommended dosage 25 milligram taken orally twice daily with food or without food. As mentioned, this is a small molecule. Molecule weight is 507.54 gram per mole. Hydrogen bond acceptor 8, hydrogen bond donor 3, log B 3.29. Polar surface area is 110 square angstrom. Mechanistically, this medication works as a small molecule kinase inhibitor targeting Bruton's tyrosine kinase, BTK, and other kinase as well. This would block the release of histamine and other pro-inflammatory mediator in the downstream pathway. mechanistically, so this medication works as a small molecule kinase inhibitor, specifically targeting Bruton's tyrosine kinase. So therefore, you can see based on the drug name, ending with brutinib, reflecting this is the inhibitor for Bruton's tyrosine kinase inhibitor. Pharmacokinetically, Tmax about 1 hour. That's the time to reach the maximal drug concentration in the plasma. Volume of distribution at the steady states 1,238 liters, very large volume of distribution. So given this is a very lipophilic drug molecule, log P is about 3.3. Protein binding 95.4%. Metabolism, this medication will be metabolized by CYP3A enzyme. So that's the major metabolic pathway. Half-life is 1 to 2 hours, which means a pretty short half-life for this medication. But on the other hand, because this medication drug molecule contains this macroreceptor, so therefore the inhibition mechanism will be irreversible, covalently bound with the proton tyrosine kinase. So therefore this can lead to the prolonged duration of action, justifying the twice-daily dosing. Excretion profile in the urine 30%, but 2.9% as a parent drug molecule. In the feces 70% as the majority of the metabolites. Drug-drug interactions. Given this medication is metabolized by CYP3A4 enzyme, so you can see for patients if they take Rapsido along with strong or moderate CYP3A4 inhibitors or inducers, avoid concomitant use, because the CYP3A4 inhibitors would increase the drug exposure for Rapsido. In a similar context, the CYP3A4 inducers will decrease the drug exposure for Rapsido, which can lead to decreased efficacy. So therefore, in both scenarios, need to avoid concomitant use. For patients, if they take Rapsido together with P-glycoprotein substrates, for example, digoxin, that's the heart failure medication, and so this can lead to increased exposure for P-glycoprotein substrates. So for example, the digoxin, and the reason for that is because remibrutinib is a P-glycoprotein inhibitor. In addition, for patients, if they take Rapsido together with antithrombotic agents, make sure to monitor closely and consider associated risk and benefits. Currently, there are no contraindications on the prescribing information. Adverse effects greater than or equal to 3%, nasopharyngitis, bleeding, headache, nausea, abdominal pain. Here are all the key references which I have used to prepare for today's video. The US FDA Novel Drug Approval Updates for 2025 is a very valuable resource. In addition, most of the medication information which I shared today are based on their respective prescribing information documents. All these documents are available at the US FDA drug websites, along with the manufacturer drug website as well. Finally, I want to thank you all so much for watching. If you enjoyed the video, consider subscribing for future medication video updates. As always, keep learning and elevating. Thank you so much.